Hi, I'm Rebecca, and on behalf of my co-authors, I will present to you our research on privacy mental models of electronic health records, a German case study. Why electronic health records? When we talk about electronic health records, we mean the central digitization of health records. EHRs have the potential of better patient care, for example, by placing less burden on the patients to inform doctors about their medical history. But health-related data must be shared, which can lead to privacy implications. Thus, the data management structure has to be designed with care, since patients might otherwise reject the adoption of the digitization of their medical records. Germany in particular is currently introducing centralized EHRs nationwide. That's why we captured the privacy mental models of German citizens on the EHRs. I will just give you a short-note definition of mental models. For the complete definition, please refer to our paper. But for now, we can say that mental models are internal representations in the human mind used to explain the real world to decide on how to act. An example would be driving with a car. Therefore, we only need to know what happens when we step on the different pedals, but not necessarily how the whole engine works. But still, if we would confuse brake and acceleration, that would be a misconception with severe impact. Okay, let's get back to electronic health records. The German EHR is available since 2021. And after treatment, health insurances get the doctor's ID, the billing code, and a billing code which is used for identifying which treatment patients received, and data to identify the patient. From a privacy perspective, the health insurance company cannot get more detailed information. Okay, let's have a more detailed look at the infrastructure. As one important component, we have the health insurance. The health insurance provides a health insurance card to their patients, as well as an electronic health app. With the app, patients then can manage their data, meaning their medical files, and manage the access to their health records. In particular, data management means that patients can view, upload, or even delete documents from their electronic health records. For the access management, they can grant or revoke access to doctors. Since patients can delete data at any time, the data is lost if doctors do not have the data stored locally in their doctor's office. Okay, so we have on the one hand the health insurance as the app provider. There's no central app for all German citizens, but as many apps as there are health insurances, which means right now we have 85 different apps in Germany. However, the health insurance only provides the platform for managing the EHRs and does not have access to the data. Full access to the actual data, meaning the medical files, do only the patients themselves have, and the data is stored on an encrypted server. Now that we have understood the German infrastructure, let's look at our research questions. To contribute a part in evaluating the understanding and acceptance of German citizens towards EHRs, we took a look at the mental models of individuals. Since the correctness of mental models also impacts adoption and usage intentions, we looked at the misconceptions patients have regarding the EHRs. And finally, our third research question is about the risk patients perceive in the context of EHRs. So, therefore, we conducted semi-structured interviews with 21 participants that included first a warm-up, where participants were asked questions about their family doctor and how they store their patient data or what they think about it. And then we had a drawing exercise where participants were asked to draw a model of the EHR based on their personal expectation. To make it easier, we handed them entity pictograms as well as distractor pictograms, pencil and paper, and instructed them to draw the model in the scenario of visiting a new doctor that wants to get access to their existing electronic health records. To round off the interviews, the real model of the German electronic health records was shown and explained to the interviewees using the scenario as before. Then we asked the interviewees follow-up questions, considering their perception of the real infrastructure, if they have ideas for improving the infrastructure, and whether this would change their willingness to use electronic health records. That's our study design, so let's look at our results. Here we can see two exemplary sketches of our participants, and you can see the participants use different entities, including a patient, doctor, or the health insurance, and a central server. Yes. And as you can see on the right side, the model is more detailed than the one on the left side. And based on the drawings and the interviews, we then did a thematic analysis and found the following misconceptions. Electronic health records in Germany are not available. None of our participants did use the electronic health records, although it was already introduced a year before we conducted the study, and the vast majority of them have not even heard about it. Doctors have full control. Participants gave doctors more power and more authority compared to reality. Emergency access is available. No, it's not. Participants thought that emergency doctors have access to their data and can, in case they are unconscious. However, the data can only be accessed in cooperation with the patient. Health insurances have all access. Several participants thought that the health insurance has full access to their EHRs because it is needed for billing. The last misconception led to participants perceiving the role of health insurances as a risk. Participant number 17, for example, said, the health insurance and access to the data, I think that's very, very tricky. Particularly, participants were concerned that by having access to detailed patient data, health insurances might increase the contribution patients pay for being insured when they have certain diseases. And therefore, participants identified privacy towards health insurances as essential. And several participants even suggested that the app provider should not be the health insurance company. The second risk our participants identified is the role of patients. On the one hand, participants really liked that patients have control over their electronic health records and can authorize doctors. On the other hand, they were concerned of mindless deletion of important data. Based on the mental models, misconceptions, and perceived risk, we came to the following takeaways. There are challenges for non-smartphone users. Patients with an electronic health card only can get very limited access and are dependent on their doctors to exert control over their electronic health records. So different possibilities for electronic health record access should be offered. For example, smartphone and desktop apps, as well as options for people without technical devices. Patients should not depend on any healthcare provider to manage their electronic health records. Then we think insurances should not provide the electronic health records app. A central access and management option should be provided by an official entity different from the health insurance company. The ultimate power of patients limits data access in an emergency situation. So we think it would be better if there's a secure and easy-to-use way for emergency data access, which should be provided. Okay, this concludes my talk. Please make sure to check out the talk of our Digital Lab on Friday. And thank you for your attention.